So Mothering Justice is an organization working on advocating on behalf of moms. We really believe that moms are the keystone in a family, a society, a community, and when mom's doing well, everyone's doing well. So we traditionally work on financial stability issues like leave, affordable childcare, wage theft, things like that. But we also believe that we really need to be focusing on how mom's doing health, mental, and financially.
What happened was we were having conversations with moms, and we weren't initially starting the conversation off about maternal health. We were talking to moms about what they needed, and what kept coming up was we kept meeting moms who had lost babies or had their pain ignored during childbirth and things like that. And so we started to study the numbers, and we realized what was happening in the community.
So we don't talk about race, and we need to talk about race, right? We talk about how women are treated in a different way, their symptoms appear different, and there's not really a problem. We talk about those issues when it comes to differences with gender. But then when we come to differences with race, it's really hard for us to have a conversation about how do we address this problem in this population. How does a woman who is living in poverty get to her healthcare provider? Does she have to change 10 buses? Is she working a low-income job where she can't actually even make her appointments? How are we addressing those issues? Or, she doesn't feel comfortable talking to someone who, it's a room full of people that might be white, and she doesn't necessarily feel comfortable. So we really need to just talk about what does a woman of color who's more likely to die during childbirth or lose her child during childbirth, what does she need? What is she saying? What is her experience? So the more we can get to talking to women of color about their experience, the more we'll uncover what the problems are and then be better able to address them.
We are in conversation with other cities in Metro Detroit to sort of get a resolution passed around this week, and at the state level, and also at the federal level.
So we were so happy to have the city of Southfield make a proclamation at recognizing Black Maternal Health Week. And we think that just that in itself is a big step, just acknowledging the problem, understanding that we need to pay attention to this problem. And that's the first step. The next step is talking to moms. We are able to do that. Every one of us is able to talk to a mom that we see that's pregnant or just had a baby, ask them how they're doing. And then we can expand that into talking to institutions and what are their practices around interventions. Do they have a really high C-section rate? Why is that? Are women coming in the emergency room and talking about pain? How long is it until they get to see an OBGYN? So we need to listen to moms is the bottom line on every level, but we can definitely work on an individual level, a local level, and a policy level.
Take my hand.
Hi, my name is Danielle Atkinson. I'm an advocate for moms in Michigan. I shared my story, now you share yours.